The alarming truth about mental health crises in children, why emergency rooms are failing our youth. Imagine being a parent, desperately seeking help for your child, who's struggling with suicidal thoughts or severe depression, only to find yourself stuck in a chaotic emergency room for days on end, waiting for a proper care bed to become available. This is the harsh reality for tens of thousands of families across the United States, and it's a problem that's been hiding in plain sight. A recent study published in the JAMA Health Forum sheds light on this disturbing trend, revealing that in 2022, more than 1 in 10 Medicaid-enrolled young people who visited an emergency department for a mental health crisis were forced to wait for over 2 days before receiving proper care. But here's where it gets even more alarming. The study's lead author, John McConnell, director of Oregon Health Science University's Center for Health Systems Effectiveness, believes that this number is actually an underestimate. The way McConnell and his team defined boarding, the practice of keeping patients in emergency rooms for extended periods, was quite generous, with a threshold of 3 days or more. This means that the actual number of children languishing in emergency rooms for prolonged periods could be even higher. And it's not just the length of stay that's concerning. The conditions in emergency departments are often woefully inadequate for young people struggling with mental health issues. Loud, chaotic environments and windowless rooms can exacerbate feelings of anxiety and despair, making it even harder for these children to receive the care they so desperately need. But what's driving this crisis? McConnell points to a perfect storm of rising mental health issues among adolescents, inadequate healthcare infrastructure, and a lack of accountability within the system. The number of kids requiring psychiatric consultations in emergency departments has skyrocketed in recent years, with one hospital reporting a tripling of cases between 2016 and 2022. Meanwhile, healthcare systems have failed to keep pace, leaving families to navigate a fragmented and often ineffective system. And this is where it gets controversial. Despite the influx of funding into behavioral health, McConnell argues that the care remains disjointed, with no single entity taking responsibility for the crisis. In Oregon, for example, community care organizations running the Medicaid program could be doing more to address the issue, but are they being held accountable? The study suggests that state-level policies could play a crucial role in reducing boarding and its impact on youths and their families. But will policymakers take action? As we grapple with the implications of this study, we're left with more questions than answers. What can be done to address the root causes of this crisis? How can we ensure that our healthcare system is equipped to provide the care that our children so desperately need? And what role should policymakers play in holding healthcare providers accountable? We want to hear from you. Share your thoughts and experiences in the comments below, and let's work together to find solutions to this pressing issue.